if they also have the common craniocervical syndrome symptoms, especially more than one. If you're seeing 3 or 4 of these, you think of it like a constellation, right? You got a star over here, a star over here, a star over here. But when you take a step back, you're like, oh, that's like a crab, right? It's a constellation of symptoms that are related. And when you see more than one of these, there's convergence points that would drive multiple symptoms like that together. That's why the correlation matters so much. If I have just a headache and no other symptom, I'd be like, huh, this will be fun. If I'm seeing headaches, dizziness, brain fog, and pressure in the head, I'm like, come on, like there's not many places that are going to cause that group of symptoms together. But if you do upright MRIs, upright is so important because it allows all the nerve structures to lay as low as they're going to and create maximum occlusion on the hydrodynamics. So if you go recumbent, the brain rises and it'll actually open up a lot of pathways. If you throw them upright, sometimes those will descend low enough, especially if they have like a Chiari malformation or a cerebellar tonsillar atopia, and you'll see the full effect it's having on that person, and it'll explain a lot more. So sometimes it's missed if it's not upright, but it should go down through the craniocervical junction. Some imaging centers have ALAR protocols. It's close, but we can even work with the imaging centers and develop super specific ones that will slice through the ligaments that we're trying to evaluate to see if there's any instability or disruption. So expanding, I'm simply saying go 2 inches lower with thin slice brain quality MRIs. 2 inches lower and you go, whoa, that's going on, that's going on, that's going on. I see it all the time. Report says brain is fine. I'm like, for real? I'm like 8 feet away. I see 4 things. But we're looking at it from a different lens, okay? The contributions to the brain, not just whether or not the brain was damaged. But what we're looking at is the flow pattern. And if you know that there should be an open flow pattern and you see areas of disruption and no flow past that, you are literally watching why the brain's breaking down.